Checks and references for foster care applicants. Hello, my name is Idris, and I'll be your host for this training session. In Session 1, we discussed the basic requirements to become a foster carer, as outlined in the Sparks Fostering Quiz. Then, in Session 2, we explored the foster family profile and the process of matching with children. Applicants who have been invited to this session have demonstrated that their profile is likely to be of interest to children's social workers, and that they have a clear and realistic understanding of the needs of children who require foster homes. Today, we'll be exploring the sections of the fostering assessment that are highlighted in purple. These are the references and safer care checks. These checks help Sparks Fostering to confirm that applicants can provide a safe and nurturing environment, and that they have the values, skills, and resilience needed for this important role. This does not mean we're looking for perfect people. In fact, many excellent foster carers have overcome significant challenges in their own lives. These experiences can bring deep empathy, insight, and strength to the fostering role. In this session, we'll look at what we're checking, why these checks are important, how we assess both risk and potential, and the ways we support applicants throughout this stage of the journey. Let's get started. References. As part of the fostering assessment, we gather references to help build a fuller picture of each applicant's character, lifestyle, and ability to provide safe and supportive care. References offer insight into how applicants are perceived by people who know them well, personally, professionally, and within their family networks. These perspectives help us understand applicants' relationships, communication styles, values, and past experiences with children or caregiving. They also offer an opportunity to identify strengths, areas for support, and consistency across the assessment. References are not about finding fault. They are a key part of our safeguarding process and help to ensure the best outcomes for children. Previous adoption applications. If you have ever adopted a child or applied to adopt, it's important that you let us know. We will need to contact the adoption agency or local authority involved to gather relevant information about your application and any outcomes. This helps us to understand your journey so far and ensure there is no conflict or overlap in planning for the care of children. Please enter all relevant details directly onto the template provided in the application form, including the name of the agency, their email address, and dates. Providing full and accurate information will help us avoid delays in progressing your assessment. If you plan to adopt in the next few years, or if you have adopted a child within the past 18 months, this would not be the right time to foster. Adopted children need time, stability, and undivided attention to settle into their new family environment, and fostering during this period could be disruptive to their attachment and well-being. Previous fostering applications. If you have ever applied to foster with another fostering agency or local authority, you must provide the details of that application. We will contact the previous provider to gather relevant information about your assessment, including the outcome and any key factors involved. Please enter all relevant details directly onto the template provided in the application form, including the name of the agency, their email address, and the dates of your application or approval. It is important to note that you cannot be in the middle of a fostering assessment with another agency while applying to Sparks Fostering. Applicants can only be approved by one fostering agency at a time. If your application was refused or withdrawn by another agency, that does not automatically prevent you from fostering with Sparks. Different agencies may have different criteria and approaches. However, you should include a brief explanation in the comments section of the form, not on the template, to let us know the reason for the refusal or withdrawal. This allows us to assess your application fairly and with full context. Childminding. If you have ever been an Ofsted-registered childminder, it's important that you let us know. We do not need to know about informal babysitting arrangements, but formal childminding roles are relevant to your fostering assessment. If you are currently working as a childminder or plan to continue during your time as a foster carer, we will need to explore how you will keep the fostered child safe, particularly in environments where there are other children and families present. Also, how you will manage the increased commitment, including attending meetings, training, and being emotionally available for a foster child who may have complex needs. We'll discuss these points with you during the assessment and consider whether adjustments or additional support might be needed. Own children. If you have your own children, whether they are living with you or have moved out, we take their views into account as part of the assessment process. We ask older children, including adult children who no longer live at home, to provide a written reference. This helps us understand the family dynamic and how fostering may impact your children, as well as their perspective on your ability to care for others. The assessing social worker will also aim to meet all of your children in person, regardless of age or living arrangements. These conversations are an important part of ensuring the whole family is prepared for the fostering journey. Education for own children. As part of the assessment, we request a reference from the education provider for each of your school-age children. This helps us understand how your child is doing in school, their general well-being, and whether there are any concerns that may need to be considered when introducing fostering into the family. This reference also supports our overall understanding of the family's capacity to manage additional responsibilities and change. Employer current. We require a reference from the current employer of each applicant, including any voluntary roles. This applies whether the role is full-time, part-time, paid, or unpaid. If you have more than one role, or if you've recently changed jobs, please include details for all relevant positions. Employer and voluntary work references help us understand your reliability, professionalism, and how fostering might fit alongside your existing commitments. If you're not currently working or volunteering, that's absolutely fine. Just make sure this is clearly noted on your form. Employer previous. We require references from all previous employers within the past year, as well as from any past roles, regardless of when, that involved working with children or vulnerable adults. These references help us assess your experience, safeguarding awareness, and suitability to foster. Please include the name and contact details of the organization, your role, and the dates of employment in your application form. This applies to both paid and voluntary positions. Family member. We require a reference from at least one family member for each applicant. This could be a parent, sibling, adult child, or another relative who knows you well. Family members can offer valuable insight into your background, values, and relationships, and help us understand your support network and family dynamics. Please choose someone who has regular contact with you and can speak honestly about your character and suitability to foster. Friend. Each applicant must provide a reference from at least one friend who knows them well. This should be someone who has known you for a significant period of time and can speak to your personality, lifestyle, and how you interact with others, especially children. Ideally, this should be a friend who has seen you in different settings and can offer a well-rounded view of your strengths and supportiveness. Health professionals, household members. If any member of the household is currently receiving support from a specialist health professional, such as a consultant, mental health practitioner, or other specialist, we may need to obtain a reference from them. This helps us understand any health needs that might impact the fostering environment and ensures that the right support is in place for everyone in the household. This is not a judgment, but part of our responsibility to assess the stability and readiness of the home for fostering. Health visitor. If you have any children in your household who are under the age of 5, a health visitor check is compulsory. We will contact your child's health visitor to gain insight into their development, health, and overall well-being. This check helps us ensure that your own young children are thriving and that the household is prepared for the additional responsibilities that come with fostering. It's a routine part of the assessment for families with young children. Household member. If there is any other adult living in your home, someone who is not your partner or child, we will need a reference from them as part of the assessment. This includes lodgers, extended family members, or close friends who live with you. Because fostering affects everyone in the household, it's important for us to understand how this person relates to the applicants and how they feel about fostering. We also assess their role in the household and whether they'll have any contact or involvement with the children placed. Landlord. If you are renting your home, we will need a reference from your landlord. This is to confirm that you have permission to foster in the property, that your tenancy is stable, and that there are no housing concerns that might impact your ability to provide a secure home for a child. Please ensure your landlord's name and contact details are included in the relevant section of the application form. Local authority for current home address. As part of the Safer Care checks, we will contact the local authority responsible for your current home address. This is a standard safeguarding check to find out whether there has been any previous or current social care involvement linked to your household. It's important to note that having had involvement with social services does not automatically prevent you from fostering. If any issues are identified, they will be risk assessed as part of the overall application. We'll consider what happened, how long ago it occurred, what has changed since then, and how it might impact a child placed in your care. We assess each situation individually and sensitively, with a focus on ensuring a safe and supportive environment for foster children. Accurate address details are essential so that we can carry out this check efficiently. Local authority for previous home addresses. In addition to checking your current address, we are required to contact the local authority for every address you have lived at in the past 10 years, as well as any address where you have previously cared for children. These checks help us identify any past social care involvement or concerns that may be relevant to your fostering assessment. As with current address checks, previous involvement with social services does not automatically prevent approval. Any concerns will be considered in context and risk assessed carefully. To avoid delays, please ensure that all relevant addresses and dates are included accurately in your application form. Ofsted. If you have ever been known to Ofsted, for example, as a registered early years provider, childminder, or in any other professional capacity, we are required to complete an Ofsted check. This check helps us understand whether there have been any concerns or compliance issues in your previous work with children. It is part of our safeguarding responsibilities and ensures that all relevant background information is taken into account. The Ofsted check will be completed using the information you provide in your application and will be sent along with a copy of your signed consent form. Please make sure you include accurate details of any roles that involved Ofsted registration or oversight. Partner, non-household member. If you have a current partner who does not live with you and is not applying to be a joint foster carer, we still need to understand their role in your life and whether they will have contact with any fostered children. If your partner will have regular contact with the child, defined as weekly or more, they will need to be assessed as a backup carer. If they are likely to take on regular caregiving responsibilities, they should be considered as a joint foster carer. As with all sections of the application, it is important to keep Sparks Fostering informed of any changes, such as if the relationship progresses and results in increased contact with the child. This ensures we can update the assessment and safeguarding arrangements as needed. Previous partners. We ask for information about any previous partners you have either lived with or had children with as part of building a clear picture of your relationship history and family dynamics. This information helps us understand your experiences, co-parenting arrangements, and any potential impact on fostering. Where appropriate, we may contact previous partners for reference. Important: if there was domestic abuse in a past relationship, we will not contact that partner for a reference. However, it is still important to tell us about the relationship. In such cases, we may ask family members or close friends to help confirm the information you've shared in a way that is safe and respectful. Please be as open and honest as possible. This allows us to carry out a fair and informed assessment while prioritizing your safety and well-being. If there are any other significant areas of your life that may be relevant to your fostering assessment, please let us know. Safer care checks. As part of our responsibility to safeguard children, Sparks Fostering carries out a series of safer care checks on all applicants and relevant household members. These checks are designed to help us identify any potential risks and to ensure that fostered children will be living in a safe, stable, and supportive environment. All information gathered is handled confidentially and used only for the purpose of completing your fostering assessment. Police involvement, DBS checks. All applicants and adult household members must complete an enhanced disclosure and barring service, DBS check. This allows us to see any relevant criminal convictions, cautions, reprimands, or warnings. If you have had any police involvement, it's important to be open and honest from the beginning. Previous involvement with the police does not necessarily mean you cannot foster. Each situation is carefully risk assessed, taking into account what happened, how long ago it occurred, the circumstances at the time, and what has changed since then. Our focus is always on child safety, but also on recognizing growth, change, and rehabilitation. Being upfront about any history allows us to support you through the assessment process and avoid delays. Court proceedings. We ask applicants if they've been involved in any other court proceedings, such as family court proceedings. Health of fostering applicants. Fostering can be physically and emotionally demanding. As part of the assessment, applicants must undergo a full medical, usually with their GP, to help us understand their overall health and any needs they may have. What we assess: are there any physical health conditions that may affect the applicant's ability to care for children? Are there any mental health diagnoses or treatment histories? How well managed are existing conditions? Is there a support network in place? Has the applicant demonstrated resilience and insight? It's not about being in perfect health. It's about being able to provide safe, reliable care. Examples: an applicant with controlled diabetes, regular medical checkups, and good lifestyle management is often perfectly fit to foster. Someone with a history of depression or anxiety may still foster if they've shown stability, ongoing support, and self-awareness. Reasonable adjustments may be possible. For example, carers with mobility limitations might care for older children with fewer physical needs. The fostering medical also gives us a chance to open up important conversations around stress management, emotional well-being, and long-term capacity. Smoking, particularly in the home, poses both health and safeguarding concerns for children. Policy guidance. Applicants who smoke cannot care for children under 5 or children with respiratory or other health vulnerabilities. Vaping is treated cautiously, but is not currently viewed in the same category as smoking tobacco. Smoking must never take place in the home or car where children are present. What we explore: does the applicant smoke? How often? Where? Are they open to quitting or reducing smoking? Do they understand the risks of second-hand smoke? Are there plans to ensure a smoke-free environment for fostered children? Support. We encourage and support applicants to stop smoking if needed. Many fostering services offer referrals to local quit smoking programs and provide a timeline for re-evaluation once changes are made. We never aim to shame applicants, but our first responsibility is to protect the health and well-being of children. Finances. We assess an applicant's financial situation, including debts, loans, and spending habits, income versus expenditure, stability over time. The goal is not to penalize applicants for having debts or mortgages, but to ensure they are not in financial distress that could compromise the fostering placement. Fostering is a professional role with an allowance. However, we must assess the financial stability of applicants. We do not require applicants to be wealthy, but they must be financially stable enough that fostering is a choice, not a necessity born out of financial desperation. Conclusion. Fostering assessments are about building a full picture of who someone is, what they bring to the role, and how we can support them to succeed. Having a past that includes challenges, such as social care involvement, criminal convictions, or mental health issues, does not automatically disqualify someone. What matters most is their current capacity, insight, commitment, and resilience. We value honesty, reflection, and growth. Each application is assessed individually, and our decisions are made with the best interests of children at the center. If you're a social worker, panel member, or support worker, keep in mind that the assessment process is not just about identifying risk, it's also about identifying potential, strength, and capacity for change. If you're an applicant watching this, please know that we're here to walk this journey with you, not to judge, but to work together for the best possible outcomes for children. Thank you for being part of this training session. Please feel free to speak openly. There are no wrong questions, and we're here to support you.